In this video, we're going to take a look at how to create and send a professional claim from within CMD. The CMS 1500 professional claim form is generally used by providers that see patients at their office or facility and perform outpatient procedures. Any user with a professional claim permission can create and send professional claims to your payers. Let's get started. Professional claims can be created from the patient section, from the scheduler, and from the claim section. Feel free to create a claim from any of these sections based on your workflow. Regardless of which section you create your claims from, the process is the same. To create a professional claim from the claim screen, click the Add Professional Claim button. We recommend starting by adding a patient. Click on the magnifying glass next to the patient field to locate the patient you want to add to the claim. Based on the patient's defaults and settings, additional fields will automatically populate. However, you can add or edit any field by clicking on the magnifying glass next to the field you want to change. Once you're happy with your selections, navigate to the Charges tab. Add diagnosis codes by clicking on the magnifying glass and searching for the code in your local list. You can do the same for procedure codes. First, use the From and To dates to select the dates of service. Then, click on the magnifying glass in the Code field to add your code. The other fields will automatically populate based on the defaults of the code selected. Adding DX pointers tells the payers which diagnosis codes relate to which procedure codes. Click on the magnifying glass, then select up to 4 diagnosis codes. If your payers require additional information on the claim, you can enter it in the Additional Info tab. To make it even simpler, you can see which fields populate in the ANSI or in which box on the CMS 1500 claim to ensure you're filling out the claim correctly. The final tab on this screen is the Ambulance Info tab. If the claim is an ambulance claim, set this option to Yes and enter the information about the ambulance trip, following any requirements your payers have. Now that your claim has been created, the next step is to send the claim to your payer so you can get paid. There are 2 ways you can send a claim from CMD: electronically to the clearinghouse, or by printing and mailing the claim to the payer yourself. If the payer supports electronic claims, we recommend that you send claims electronically. Under the Charges tab, you will find a status column for your procedure codes. This status defines what will be done with the charge. Should it be sent to the payer electronically? Are you going to print and mail the claim to the payer? Or is the balance due to the patient? If you are sending the claims electronically, update the status of the charges individually or all at once by using the Set All Charges To option. Save the claim and CMD will take care of the rest. If you are printing and mailing the claim, update the status, click Print, then select Save and Print. It's important to keep in mind that the application does not print the claim forms. You will need to purchase and load your own forms into your printer. Regardless of which option you select, our system will run the claim through thousands of edits to increase the likelihood that the claim will be approved by the payer. With our 100% real-time claim submission, if our system detects an error, you will be immediately notified so you can go back and resolve the issue before sending it out to the payer. That's all it takes to create and send a professional claim in CMD. We recommend partnering with your payers for any additional info or requirements they need included on their claims. For step-by-step directions, FAQs, and other how-to videos on the claims section, visit our Knowledge Center at help.collaboratemd.com. Thanks for watching.